Peggy. I'm Claudette. I'm going to take you back to an exam room and we'll get started on your pre-op visit.
Terrific.
How are you doing?
Good. How are you doing?
Just
see you again.
Fine. I know, it's wonderful to have you back here with us. Oh, we were pretty right on, right there. Okay. And have a seat right there, Peggy. We'll get your blood pressure and your temperature.
Okay.
And it looks like you brought your informed consent for us.
I do.
You read over all of that.
Very carefully. So let's see.
Any questions on any of that, Peggy?
This one's
Yeah, both of those.
Yep.
Any questions on any of this?
No, it's pretty thorough. Actually, you guys did a good job.
This is the hospital consent for your surgery.
Okay.
And it says, Dr. Ali has discussed the procedures that you're having with you. He's explained what we're going to be doing. We certainly don't plan on giving you any blood either during or after your surgery. But just in case Dr. Ali would need to, we want to have that still in there.
Okay.
Okay. You and he have discussed several times about the benefits, drawbacks, problems related to recuperation or the surgery itself. We think you're a good candidate for surgery or we wouldn't be doing it. And it's not too late to decide you don't want to do it. But
no,
I always tell people that's not why you're here today.
No, I'm ready to go.
All right. You're here this afternoon for your pre-op appointment. You've already been to the hospital this afternoon to have your blood work drawn. I wrote prescriptions for you.
Okay.
And you can go ahead and fill these, Peggy, but you don't even need to bring them to the hospital.
Okay.
Just have them waiting for you
At home?
for when you come home from the hospital.
Okay. Okay.
So on March 10th, your magic day, you're going to come to the hospital at 9 o'clock.
Got it.
And you all have already been there, so you know how to get to Mercy Hospital.
Should not be a problem.
Any questions? All
No
right.
questions yet.
Hello, how are you?
Good. How are you doing?
Good to see you.
Good to see you too.
Well, first I want to thank you for letting us do this.
You're welcome.
You're kind to let us share your experience with all these folks. It's our hope that this will be the kind of thing that will kind of demystify what the experience is like for people, and
Good.
if that can help people, that would be wonderful.
I hope so too.
All right. I just wanted to go over some things about your history, just to confirm them. We met each other before.
Yes.
Just to confirm the information. You're 47.
Yes.
And you used to weigh 330 pounds. And then you dropped down to 175 pounds last time we saw you. That's wonderful. And you had gastric bypass surgery in, let's see, July of 05. So how long did it take you to lose that weight?
A little over a year and a half.
Yeah.
Around in there.
And you've been stable at that weight for how long?
About 5 months now. So.
Okay. We generally don't operate on people till they've stabilized their weight and they've maintained it for somewhere between 5 to 6 months.
Okay.
What we're going to be doing during this particular surgery is the arms, and we're going to do some breast work, but I think for the purpose of the webcast we're going to concentrate on the arms and discuss that.
Okay.
Okay. And have you had a chance to read the consent form that
Yes, very carefully.
Okay. And do you have any questions about that?
Not at this
Anything
time.
I can
I'm sure
talk to you
it's,
about?
yeah,
Okay.
I'm pretty comfortable with the information you provided. It was pretty thorough.
Okay.
In that
Very
consent
good.
form, so.
Very good. Well, usually what we do during this session is we mark your arms for surgery. And it's really, you could think of it as the roadmap of what we're going to do.
Okay.
And that's why it takes a while. There's a lot of looking and remeasuring and looking at things very carefully.
Okay.
And as far as I'm concerned, actually, I think it's the hardest part of the whole thing.
Really?
The surgery itself is relatively just cut and do it.
Okay.
There are adjustments there, but this is really where all the thinking is done for surgery. Okay.